I said I'll probably move that way anyways.
You want to move it?
Oh no, it's fine. Oh, does it have wheels? Oh, yeah, that's good. Yeah. Perfect.
Okay.
That's better? Okay. So I'm not hiding in the corner.
Well, it's 2 o'clock sharp, so in the interest of time, we're going to get started finally. Thank you for all of you being here. It's not the biggest crowd we've ever had, but it's not the smallest either. And those who are here are dedicated. Or maybe the others are just tired of hearing about circulation problems. Not. I personally think it's a really good topic because we all can notice something with time in our circulation, and when it's significant and when it isn't is important to know about. So glad to be with you again. This is the program when we have our residents. Usually we have 2 at a time here in the clinic and 1 in HCC, so 3 residents. But it's usually 2 who give this talk. Dr. Shaw, the brave Dr. Shaw, showed up, but his partner was sick today. So he's doing his part and her part, and seemed unfazed by that. That would have put me in a full panic when I was at his stage, I can tell you that. But you may recognize Dr. Shaw. He's been here a few times. He's in his first year as a resident in our program, and he's given this talk once before. He gave it last time on hypertension, along with Dr. Ali, and so I know he has a fund of knowledge about this, and I'm really pleased about that. Just to remind you a little bit about him, he is a native from Arkansas. He grew up in Pine Bluff. How many of you have been to Pine Bluff before? Yeah, gee whiz. Virtually everybody. Let's just call that check. They know your hometown. We were just lamenting, to me, when I was growing up, Pine Bluff was one of the premier towns in Arkansas. And it's kind of fallen on bad times over time. I think they're doing some things to renovate and rejuvenate, but they had a chemical spill down there, and they've had some crime problems, and so it's made it into that book, worst places to live, and I think that's so unfair, but those kind of things get attention, don't they? Anyway, he grew up in Pine Bluff and went to UALR, University of Arkansas in Little Rock, and to Ross University for medical school. His wife is also in a similar place in training, stage of training, but in a totally different place. She's in California and he's in Arkansas. Some of the sacrifices these young trainees make, and it's even harder. That's hard enough. But he's got a 1-year-old son who understandably is with his mother in California, which makes it harder on her, but being at a distance from them makes it harder on him. So they're trying real hard to get that corrected. She's at Fresno and Stanford in her pediatric residency, and so they're trying to readjust where they're closer to each other. So now I've exposed your whole personal life.
Now you guys know me really well. So. Well, it's a pleasure to come here and talk with you guys. It's always awesome to come here and learn.
You're hoping I've said everything I'm going to say.
Oh, exactly, yeah. So now I can just go on with my presentation. And
He's one of the 8 residents that's assigned here all year and comes back every 6 weeks for a couple of weeks. So his face may be familiar. He's been one of the good residents we've had, and so really proud of that, and glad he showed up today. I'd be giving this talk.
Well, it's always a pleasure to come here and talk with you guys, and hopefully I can teach you guys something. Circulation is like a very big topic. A lot of problems can definitely happen with, poor circulation. You can get infections, you can get blood clots. A lot of scary things can happen, but also you need to know when something's also a benign cause too. So that's kind of why I want to go through this presentation with you guys today. So today's topic is circulation and problems of the lower extremity. So what is circulation? So at a very basic understanding, it is the blood flow from the heart to the lower extremities and all parts of the body, not just the lower extremities. Also to the brain, to the kidneys, everywhere really. So an important thing is to have a healthy heart, for you to have a functioning good squeeze to get the oxygenated blood to the lower extremities and other parts of the body. So what the heart does is it circulates oxygenated blood and other nutrients to the lower extremities in the feet. So if you have issues with circulation, you're not getting that good oxygenation and perfusion to those lower extremities, and that can cause a lot of significant problems. As again I mentioned, if you're not having good circulation, it's hard for the muscles to regenerate after a long day of walking. It's not getting the proper oxygenation, and this can cause fatigue, pain in the legs, and just overall not being able to do what you're used to doing if you're not having good circulation and blood flow to the lower extremities. Another thing that you will notice if you have poor circulation is you're not properly able to heal wounds on those legs. So if you, let's say you have like an ulcer at the bottom of your foot, if you're not able to get good circulation to that area of where the infection or the ulcer is, it's going to turn into an infection. And that's where bacteria kind of start to thrive. They're able to grow at more rapid rate, especially if you're not able to, remove all the toxins from that area. They start to generate at a rapid rate, and it can cause really bad, deep infections that could lead to sepsis or even like amputations, like really bad, deep bone infections. So that's why, this topic is very important. So here's one very common disease that we see, especially as we get older. People get this thing called peripheral artery disease. So the arteries is what brings oxygenated blood to the parts of the body. So if you think of it as a pipe that brings blood or brings fluid to a certain area, if there is calcifications or blockages in those areas, it's harder for the blood to reach through, especially the further you are away from your heart. It's harder to get that blood flow to those areas, especially if you have really bad calcification. And calcifications happen naturally. That's a natural progression of your arteries, especially with time. There's other diseases that can rapidly progress that calcification, such as hyperlipidemia, also known as like high cholesterol. Another thing that could rapidly increase calcification is hypertension, really high blood pressure that hasn't been managed for a long time. And even just genetic causes. Some people are just genetically predisposed to, having rapidly progressing coronary artery disease or peripheral artery disease. So again, these narrowing and blockages leads to less oxygenation of those lower legs. Also, when you don't have a good oxygenation to your legs, you'll start to notice, you'll start walking and then you'll start to have this pain in your leg, and it's only whenever you start to walk. Has anyone ever experienced that, like just pain just when you walk? Usually that's a sign of peripheral artery disease, something called claudication. So it's kind of like a demand ischemia or a demand. So it's a symptom that happens when, that area is wanting more oxygen, but it's just not able to get it because of that blockage there. And then whenever you start to walk, that's when you're not getting that good oxygen there. It starts to cause a significant amount of pain. And again, that's called claudication, and that's one symptom of peripheral artery disease. Another thing I mentioned is ulcers. Again, with peripheral artery disease, you're not getting oxygenation to those lower legs. Another group that's really at high risk for this kind of thing is folks with diabetes, pretty advanced diabetes that causes neuropathy. Have you guys heard of neuropathy before? Yeah. So if you have neuropathy, you have issues with the sensation of your feet, right? So it feels like a tingling sensation. You don't really feel too much feeling in those feet. Causes you to be a little bit unbalanced sometimes, and you're prone to kind of hitting your feet on things and you're not noticing it, and you can cause open wounds there that you don't notice. And if you don't check your feet regularly, you may have an ulcer down there that you don't know about that can get really badly infected, especially if you have peripheral artery disease on top of that. So especially those folks with diabetes and neuropathy, you definitely want to be checking your feet for those ulcers and making sure you're not growing anything there, okay? Does that make sense? Okay. Any questions so far? No? Okay. They went the wrong way. Let's see here. So what are some treatment options for peripheral artery disease? A lot of folks here don't smoke, so I don't really have to labor this too much. So that's a great thing about this population here. But smoking is one disease-modifying thing that you can do to stop the progression of peripheral artery disease. So if you are a smoker, it's highly recommended to stop smoking because it really causes calcification of those arteries. Daily exercise, even though you have the pain with walking, there's something called graded exercises that you can do. You kind of titrate how much exercise you do, and you start to kind of build a tolerance to the pain, and also it helps with the circulation too. So, if you worked with physical therapy, and if you had peripheral artery disease, we could definitely talk about graded exercises to kind of help with these problems. Another thing is a healthy diet. High fiber, low trans fat, not too much meat, veggies, and fruits. So what are some medications that are also prescribed with peripheral artery disease? So you could take some things that will lower the risk of platelets forming or causing clots. So these are antiplatelet agents such as aspirin. There's another one out there as well, Plavix. You'll sometimes see that one too. And there's a combination, if you have severe peripheral artery disease, they sometimes do aspirin and Plavix together. Another one is a cholesterol lowering agent to stop from the plaque building up in those arteries, which is a statin, like atorvastatin. It's another very common one. Again, blood pressure management and diabetes management. If you have both of those issues, you want to get those under control at a good level, so you're not worsening the calcification of those arteries. Now, if you have really severe peripheral artery disease that's causing, really bad infections, there's sometimes or if it's causing really bad limb ischemia, which is just complete poor perfusion of the lower leg, you'll see like a complete change in the color of that leg. Sometimes it will turn purple in certain parts of the lower legs. You can do angioplasty where they go in and place a stent kind of thing, or a balloon to kind of open up those vessels. And those are in very severe cases of peripheral artery disease. Another thing that could be done is bypass surgery. So you will connect a vein to the artery and connect it to the the part of the artery that's not getting any circulation. So you kind of bypass the blockage. And here's another diagram where I talked about limb ischemia. So if you notice here, here's where ulcers can start to develop and you get a really deep infection. And then sometimes it will go from red to this greenish or blackish color here, or purple color. And that's when you know it's a very serious issue going on here. And here's another diagram of how the calcification can definitely cause issues with circulation or blood going from one area to another. Any questions about peripheral artery disease, anyone? Sure. Right here? Muscle below blockage begins to die. Mm-hmm. Any other questions? No. So we talked about arteries. Again, arteries are what brings the oxygenated blood to the different parts of the body. Now we're talking about veins here. So veins are the vessels that bring blood back to the heart so it can get reoxygenated from the right part of the heart to the lungs and then go back to the left part of the heart and then get circulated out to the rest of the body. So veins are the delivery system from the other parts of the body back to the heart to get reoxygenated. So now we're talking about veins. So here's another common thing we see in the clinic is chronic venous insufficiency. So these are when the veins have a hard time going back to the heart, especially with the lower legs, because if you think about it, you're going against gravity. You're going from your feet having to push that blood all the way back to your heart. And the way that works is the veins have these one-way valves that push blood from the lower limbs to the heart. So if you have issues with those valves in those veins, what happens is it starts to pull in the lower limbs, and then you can start to develop swelling. So again, when you have this chronic venous insufficiency, you have a hard time returning the blood from the lower legs to the heart effectively. And then you'll start to notice pooling in the veins. This can sometimes lead to clots. Mm-hmm. Yes, for sure. It could definitely cause discomfort. If you get something called a deep vein thrombosis, that can also cause some heaviness and some pain as well. But yes, it definitely can cause some discomfort for sure. Has anyone here have dealt with chronic venous insufficiency before? Okay. So with that, this can also lead to like these swellings in these veins, also known as varicose veins, which is just these thick prominent veins that you'll see in the lower legs. You can see them in other places of the body as well, but commonly you will see in the lower extremities. This can lead to skin discoloration just because you have blood that's pooling in those lower legs and it causes skin changes, skin color changes. Another thing is whenever you have this pooling of blood in those lower legs, you're at an increased risk of ulcer formation as well. So again, it can sometimes be pretty benign, but also it can become a serious issue as well. So what are some common treatments for chronic venous insufficiency? I'm sure you've been in the clinic before, and if you have this issue, we constantly tell you guys, wear your compression stockings, keep your legs elevated, stay hydrated. We sound like a broken record when we say this, but that's what is the most common treatment for these kind of things. And they're preventative for sure. I know it's hard to get those compression stockings on, and sometimes you may need help getting them on from someone else, but you definitely need to have them on if we were recommending it. So wearing compression stockings can help with the blood flow. What it does is it causes like this outside pressure force on the legs to allow for the blood from the lower legs to help it push back up to the heart. So that's kind of the mechanism of what a compression stocking does. It just helps you. It helps that collapsed vein to kind of push blood from the lower legs back up to the heart. It helps out with that. If you have a very significant amount of swelling in those legs, especially when we see folks who have other diseases like heart failure, if you have venous insufficiency, on top of that you also have like heart failure, you can have really significant swelling in those lower legs. One thing that we can do is give you a diuretic pill or a medicine to kind of help you offload that fluid from you by urinating it out. And then there's some fancy procedures here that I've actually never seen done. Sclerotherapy, endovascular laser therapy. So these are all pretty advanced procedures that I haven't actually seen yet. So here's a diagram of how a compression stocking works. So if you see here, when you have these insufficient valves, you have this venous blood pooling here. You develop a clot. You can develop ulcers. You can develop really bad swelling, some varicose veins. And that's when you're not wearing the stocking. So with the compression stocking, it kind of straightens out that vessel, if you can see here. That's the theory behind the compression stocking. And here are some pictures of, I should have made it bigger, I'm sorry about that. But here are some pictures of some chronic venous insufficiency and the progression of how it will look like. As you can see, you'll start to have some color changes here in more of the severe cases, and then you also have this ulcer development here. Any questions on venous insufficiency so far? So now here is a little bit more of a serious complication of chronic venous insufficiency. This is known as a deep vein thrombosis, or a clot in one of the large veins in the lower legs. These clots usually form with folks who have chronic venous insufficiency, who are not utilizing their compression stockings very well. Also, folks who are just immobile, have a difficulty with walking, maybe they're bedbound. Another common population we see it in is folks who recently had surgery, who've had to be bedbound because of a recent procedure. Another group that we see DVTs in are folks who have cancer. Cancer is a procoagulation state. So when you have cancer, it causes you to rapidly develop blood clots. So that's another population we also see DVTs in. Most commonly, you'll see it in one lower extremity. You'll notice patients who have either their right leg or left leg, one of their legs is disproportionate to the other leg. They'll notice like a swelling there, some heaviness, maybe some tenderness, also skin discoloration in just one leg, and that's pretty hallmark for a DVT in one of the lower extremities. One of the more serious complications of a deep vein thrombosis is a pulmonary embolus. So what a pulmonary embolus is, it's a clot in the lower legs that gets dislodged from the lower legs and gets shot up into the lungs, which can cause really bad shortness of breath, chest pain, and even death if it's a very serious clot that goes into the lungs. So what is the basic treatment for a DVT. We have, anticoagulation therapies. So this is different from aspirin and Plavix. Aspirin, Plavix, those stop platelet formation. But with these anticoagulation medicines, they actually stop coagulation in general. So any clots in general, that's what these medicines do. They stop those clots from forming by blocking certain factors in the clotting system or clotting cascade. So there's common medications that we see here is apixaban, robopixiban, heparin, and warfarin. Usually, treatment is 3 to 6 months for a DVT, but it could be longer if you have a pulmonary embolus episode. The duration sometimes varies in different patient populations. Another treatment is compression stockings, early mobilization after a procedure. We want you to, if you've ever had a surgery done, usually like day after, they're hounding you about getting up out of bed and moving around. So, and the reason why they're doing that is they want to prevent a deep clot from forming. So that's the reason why they're so mean to you guys, saying, "Hey, you need to get out of bed. I know you just had a surgery, but we need you to mobilize earlier so we can prevent a clot from forming." When you're on these blood thinning medications, there are side effects. Major side effect is bleeding. We'll have folks who have bloody stools, bleeding from their mouth. If they have an ulcer in their GI tract, it can sometimes lead to bleeding in those areas. So there is caution with these medicine, and we constantly want to monitor you guys and see, if there's any signs of any bleeding. And that's why we don't want to have you on this medication for more than what we need to have you on these medicines for. So there are some side effects. Another thing we worry about is if you have issues with mobility or if you're prone to falling. Last thing we want is if for you to fall and bump your head and end up having a bleeding episode in the brain. So that's one thing we definitely want to outweigh the risk and benefit of these therapies. So here's a picture of how DVT can look like. If you notice here, this leg is a little bit larger than this one here, and then you can see some skin changes that are not prominent on this leg right here. So usually when we see something like this, we're thinking deep vein thrombosis, and one way we can verify that is by getting an ultrasound of that leg and seeing whether or not there's a clot there. So after talking about all those, what are some signs of poor circulation? You can have, coldness in the legs and in the feet. You can see some skin color changes, as I mentioned before, abnormal redness or purpling. If you start to notice those things that's abnormal from what you're usually used to, come see us and we'll take a look at it and evaluate it. Another thing that could cause poor circulation is another symptom of poor circulation would be like numbness or tingling. Again, it's hard to differentiate that if you have ongoing neuropathy. So it's hard to kind of differentiate those if you already have a existing disease such as neuropathy. Pain while walking, that's another sign. Usually you would notice it in your calf muscle, and it's only when you're walking. When you're at rest, the pain gets better. So that could be a sign of peripheral artery disease. Unilateral leg swelling or bilateral leg swelling. Again, with bilateral leg swelling, so both your legs having swelling, it could be venous insufficiency. And as we mentioned before, compression stockings would be a good treatment for that, staying hydrated and keeping your feet elevated when you're sitting. If you notice a sore on your feet that has a trouble healing on its own, come by and let us look at it. It could be something serious, and we definitely want to catch it early before something happens, or before you get a deeper infection. And I mentioned before, skin color changes. Risk factors, age, everyone is going to get it. Everyone is going to get calcified arteries. That's a non-modifiable risk factor. Everyone will get older, and we can't really change that. But certain diseases like diabetes, and we can manage the diabetes. If you're a smoker, we can manage that. We can, yeah, yeah, yeah. You can just stop the cigarettes. Another modifiable disease is high blood pressure. We can manage that. High cholesterol is another thing we can manage. Another modifiable risk factor is lack of mobility. If you have mobility issues, we can set you up with physical therapy, and we can find an exercise regimen for you that can prevent these clots from forming, or yeah, yeah. Obesity. That's another modifiable risk factor as well. So, what can you do to help yourself with circulation? Move your legs often, go for walks, do some leg exercises. I know over here you guys have the benefit of the workouts with Jennifer, I believe, and please take advantage of that. She's a great resource for exercises and finding something that works for you. Um, Elevating your legs when you're sitting. Try not to stand for too long a period of time, and wearing your compression stockings as well. And here's some stuff you can discuss with the staff. Ask them help with daily walks if you need help. Ask them to check or you can come by our office and we can check your legs out if you have some concerns, to make sure there's nothing going on there. Yeah, pretty much it. And then when to come and see us if you start noticing any new pain, numbness, abnormal sensation in the feet, like a cold sensation that's new, swelling in one leg, a wound that's not healing, and discoloration of the toes and feet. All right, I think I got through everything I wanted to talk about. You guys have any questions for me right now?
The only time I've had really bad problems is after a long plane flight. And great swelling, I had blisters up and down.
I'm so glad you mentioned that. I was going to bring that up. All of you travel some, have traveled a lot. It's a good thing to remember. I think what the standard recommendation is that every hour or so you get up and take a walk down the aisle. And if you're self-conscious about doing that or don't feel steady, moving your legs, flexing your legs as you sit. You see these little machines. I'm not sure how good those are, but you can do every bit as much just by flexing your legs at the ankle especially. Yes, ma'am.
I used to always wear compression stockings on airplanes. Well, now I do.
Stockings are a good idea.
Is it the elevation that contributes or not?
Not really. It's sitting. The venous. I'm just glad he differentiated so well the arteries from the veins, and as far as the problems they get. The arteries can be more serious, circulation to the leg, you don't want to lose that. But the most common is the venous problems. And because it happens to almost all of us. I would guesstimate of the chronic conditions that we all get with aging, number one would be hypertension. There's probably 5% of the people on this campus that don't have high blood pressure. osteoarthritis, whether you feel it or not, there's usually some arthritis after a certain age. Venous insufficiency, I would put number 3. And it's because all of us with time now, unfortunately, women are even more prone because every time you have a pregnancy, it stretches the vein circulation more. These valves he talked about are just the most remarkable thing. These one-way valves, blood goes up and it can't go back until your veins get so overstretched that the leaflets don't touch. That's venous insufficiency. And the worse that is, the more likely the thing's serious, like a DVT, which isn't real common, but it's real. It's potentially life-threatening, so it's real serious. But if you think so, walking is one of the most important things to mobilize the swelling, for one thing. Those muscles contracting as you walk help pump the blood uphill against gravity. Yes?
I see on television a commercial now advertising this little exercise thing. And is that helpful?
I guess it's better than doing nothing, but yeah. I was just saying that if you're sitting on a plane, doing this does just as much or more. But
There's someone here who says that she has to walk so much because of her condition. And she said, I get tired of walking. I wonder if that little machine would.
it wouldn't take the place of walking. I don't want to overstate it, but I think they're going to make a lot of money on those, but I think it's going to be minimally helpful. That's what I think, just my opinion. Yes.
What are clues to warn you that you may have pulmonary embolism? My mother passed from pulmonary embolism, and as far as I knew, we had no clue as to.
You want to answer that? Or where'd you go? Okay.
Yeah, so with a pulmonary embolus, you'll start to have, really bad chest pain, shortness of breath out of proportion from what's normal. Usually those are some of the hallmark symptoms is a shortness of breath.
And
chest pain.
the pain, the chest pain is real characteristic. It's pleurisy. It's pleuritic pain, where you take, the deeper you breathe in, the sharper the pain is. That kind of pain could mean a pulmonary embolus. I'm sorry? I did.
So with a heart attack pain, so with a pulmonary embolus pain, what he mentioned was a pleurisy. So the more characteristic sign of a pulmonary embolus chest pain is when you have pain on deep inspiration. So whenever you're having a deep breath and you notice a sharp pain in a certain part of your chest, that's more likely going to be a pulmonary embolus. Could it be associated with a heart? Yes, it could.
But heart pain is almost always dull. It's either pressure or squeezing or heaviness. If you're worried about, or in patients we're worried about, could this be heart pain? I love hearing them say it's sharp like a knife, like a needle, because that's not heart. That's not coronary disease anyway. So just finishing up that about the legs and the veins and so forth. We always tell people to raise their legs, or elevate their legs when they can. The reason is when you're sitting with your knees bent, then your leg is bent here at the hip too. Think of it like the deep veins that carry all the blood and the fluid. Think of it as a water hose, and that water hose is kinked here and trying to take blood uphill, upstream. And so, if you can have your legs straight, and if you can move them when you have to have them down, it's really important.
We have one more question over here.
Sure.
Are you aware of any preparations that would clear the calcification in the veins? medicines or whatever? How can you clear that?
Clear the calcifications. Unfortunately, there isn't really anything that we can do to clear the calcification in the arteries, but there are things that we can prevent it from getting worse. And those are taking care of your blood pressure. If you have diabetes, making sure we're taking care of the diabetes. And if you have high cholesterol, making sure you're on appropriate medicine for cholesterol to prevent more plaque from forming. Now, if you have a really severe peripheral artery disease or calcification that needs a bypass or a stent placed, and that's a different scenario. But there isn't anything that removes the calcification that I could think of.
I agree. And I was glad he made the comments he did about smoking, and I'm proud that
Something we can work on.
Yes. Yes, maybe one day we'll come up with a treatment for that.
Yeah, you know, the smoking, and I know I'm preaching to the converted here because I don't think there's a person in this audience that smokes. I'm gonna believe that anyway. There's nothing worse than smoking to make those plaques and blockages in the heart and in the peripheral arteries. It's like if smoking is like having a spark and throwing gasoline on it. That's how it accelerates those plaques to grow. So quitting cigarettes is far and away the most important thing you can do. Other questions? Yes.
I have numbness in my feet, and I've always thought it was a nerve problem. It could be.
For most people, it's neuropathy. Yeah.
Okay. Not a blood thing. Because I'm real active and going and walking and hiking. So it's nerves.
You're probably right. Yes.
I have restless leg syndrome. Is that anything to do with the veins? No. What is it?
Restless leg syndrome is not associated with any like clots or any venous insufficiency really. A lot of times restless leg syndrome can be associated with anemia though. So if you have low iron in your blood, you can definitely develop restless leg syndrome.
It's not usually a circulation problem, restless legs, but it is a bad sleep disorder. Fortunately, there's pretty good medicine for most people, a few different ones, and one doesn't work, the other often does. So hopefully. Great questions. Any last question? I see a hand.
I think hereditary is a factor too. I know in my family, my mother and my sister had blood clots, and I had lots of kidney problems. And
Yeah. I think it runs pretty strongly in families. Yeah, exactly. Well, thank you for your attention and your participation, and always love this group. Thank you.